Hey, it's John, and welcome back. Well, if you're linking over from a previous video that you saw where I was discussing different spinal ailments and avoiding certain exercises to keep things safe, well then in this clip, the next few minutes is what you're going to really want to pay attention to. Since people who have osteoporosis should avoid rounding the spine, an isometric crunch is a much safer alternative than a traditional sit-up. Shown here, one leg should be straight while the other is bent. You can use either your hands or a rolled towel to be placed underneath your lower back for any support. Without nodding your head at all, lift your torso 1 to 5 inches up from the mat. Your head will lift along with your upper body. Making sure to breathe while holding this contraction, you can hold this position anywhere from 1 to 5 seconds. If your neck experiences any discomfort, an alternative would be an isometric crunch using an exercise ball. With your knees bent and arms stiffed, contract your abdominals as if you were lifting up towards the ball. Keeping your head down and not bringing it up will help keep your neck supported during the contraction. Arching the spine can create pain for people with spinal stenosis. To modify the common bridge with an exercise that helps keep the spine in a more neutral position, use an exercise ball placed under your ankles. We're going to perform a straight-legged bridge. The wobbly ball will create more challenge while trying to stabilize your hips, all the while engaging your pelvic floor muscles, hamstrings, and glutes. For an added challenge, lift both arms up from the mat prior to the lift. It's good to know that if your back is a little achy, moving the ball closer and maybe even under your knees will help reduce pain and provide more support. To replace the Russian twist, we will target your right obliques and left obliques separately. Laying sideways will reduce any compression forces on your SI joint and lumbar vertebrae. Compression is a typical reason for symptoms like sciatica and SI joint dysfunction. First, you must make sure that your top ear, shoulder, and hip are aligned. Then, while rolling back, you must prevent that top shoulder from moving around. We don't want to be reaching in the backseat of a car with the shoulder. It stays locked in place. So when you're ready to roll forward, contract those obliques, which are located around the lowest rib area, to pull your torso back to the beginning. Now your top leg should not leave the bottom leg, and a pillow can always be placed between the knees for added comfort. Well, there you have it. A handful of common core exercises that you see many folks doing, some of whom maybe shouldn't be. Were you one of those folks? Did you make a mistake? That's okay. Because I'm so glad that you decided to click on that link to get to where you are now, because now you know. Now, if all you're doing in your own core routine are those handful of exercises, that's fine. Over an extended period of time, you should get stronger, and you might even reduce a little bit of back pain. But if you want a more robust routine that's proven to be safe and highly effective, then cruise through my website and click on my core video icon. It's there you're going to learn all about the routine that I do with my own clients and have been doing over the last decade. The results have been remarkable. From reduced back pain to longer endurance, we've even seen bone density scans increase, and that's big time. It's all available to you, either in a DVD or flash drive format. I also have a viewable version online. If you have any questions, don't hesitate to contact me. You have my email address now. Until we chat, train hard, but train smart.